Bell's palsy. Bell's palsy is the most common cause of the facial paralysis resulting from a dysfunction of the cranial nerve 7 that result in the inability to control the facial muscle on ipsilateral side. It is a lower motor neuron lesions which includes the ipsilateral loss of forehead and the brow movement, inability to close eye and the dropping of the eyelid, problem in smiling, dry eye, dry mouth, headache, loss of nasolabial fold and the dropping of the lower limb which cause difficulty in the eating. There is twitching of the face. Etiology includes the viral infections like herpes zoster, autoimmune theory, hypersensitivity and allergic theory. This all can cause the edema of the facial nerve, but the facial canal doesn't expand, so there is compression of the facial nerve which result in the Bell's palsy. Diagnosis. Facial palsy is a clinical diagnosis. Complete history taking and the physical examination is important. CT or MRI of brain for a tumor. Electromyography for the functioning of the muscle. Nerve conduction velocity for the nerve. Treatment of the Bell's palsy. 70% patient of the Bell's palsy is completely recovered. 50% of the patient is incompletely recovered. 85% of patient is recovered without any treatment. Treatment includes use of steroid, prednisolone, dose is 1 mg per kg for 7 days. If there is no improvement, then we can extend up to more 7 days, and after total 14 days, if there is still no improvement, then taper the dose and stop. Antiviral acyclovir 800 mg 5 times a day for 5 days. It is started within 72 hours only. Eye protectives include wear goggles, avoid direct sunlight, avoid windy areas, artificial tear drops, pat the eye at the night times, and facial physiotherapy. If after 7 days if there is no improvement, then steroid, eye protective and the physiotherapy should be continued for 7 days more. Antiviral should be stopped. After 2 weeks, if there is still no improvement, then we have to taper the dose of the steroid and stop. Then electrophysiological nerve testing. If there is not much damage to the nerve, then there is electrophysiotherapy. And if there is a severely damaged nerve, then labyrinthine decompression of the facial nerve